Hi, my name is Hayden, and I'm going to walk you through all of my physical therapy exercises from front to back that I used for my treatment for Abdominophrenic Dyssynergia, APD. And to talk a little bit about each exercise, I will walk through the whole sequence of what I do chronologically, from what I do in the morning in my morning routine, and what I do before and after every meal, and what I do in the evening, along with other tips and tricks along the way. So the first exercise I do in the morning is I get down on the ground and make sure I have a pillow, and I do an exercise called Diaphragm Release. So literally, you're on your back, legs comfortable, and you want to exhale, and as you exhale deeply, you want to tuck your fingers, your fingertips underneath the bottom of your rib cage. In and up is what you want to think, like you're putting hooks underneath your rib cage. The pressure's not crazy high, but it is quite firm. So there's two ways I did this, that I was taught how to do this. So the first way is I exhale and tuck my fingers under firmly, like this, and then I hold that tension in place. I take another breath, and I exhale and I tuck my fingers even further up, keeping them tense, keeping them in place, not letting up. Third breath, even more. Fourth breath, even more. And maybe I'll move my fingers along along the bottom of my rib cage and sort of just really think about pushing my diaphragm upward. And then release. And as you release, if you did it correctly, you might feel a nice sense of relief, like a nice sense of lightness, like it's not tense there anymore. Gravity is sort of keeping it in place. It's not popping back out. You can just kind of lay here for a while and just sort of enjoy the lack of tension. So that's the first way you could do that exercise. And that's what I learned first, actually, before I went to physical therapy. But what they taught me at physical therapy was slightly different. I think it's more or less the same. So you can inhale and exhale, tuck your fingers underneath, hold the tension there for 5 seconds, and then release, fingers off. And then repeat again. Inhale, exhale, tuck the fingers under, nice and firm, and release after 5 seconds. And rinse and repeat. And I would do this 8 times. This diaphragm release exercise, I would say, was one of the biggest helps to my recovery, and it's one of the most instantaneous ways you can address symptoms when they arise. So that's the diaphragm release. Now, a side note, you can actually also do the diaphragm release while standing or sitting. So I'm going to go into a seated position in my chair, and I'm seated. And you can inhale and exhale, and as you exhale, you curl your fingers underneath your ribcage, and you can even round your shoulders and your whole torso over your abdomen to help out. So it would look like this. You might do it again. Kind of hold it in place, and then you might just sort of relax back into neutral. If you're standing up, you could also do it. So I'm standing up, and again, you can inhale and exhale and sort of round your shoulders, curl your torso over your rib cage as you pull your fingers underneath your rib cage, like this. Might do it again, go a little deeper. And that might give you a nice little reprieve if you're suffering from some tightness. So that's the diaphragm release exercise. Laying down, that's the first thing I do every day. So the next exercise that I do in the morning after the diaphragm release is called a myofascial release. And it's back down on the ground again. And what a myofascial release is it is a way of basically unsticking the fascia tissue that's between your skin and muscles, I believe. It's sort of like the white part of an orange that's underneath the orange peel and between the orange peel and the orange flesh. So you just take your hands and you clasp onto some skin that's right at the corner of your rib cage. So if you trace the bottom of your rib cage down, there's a little corner at some point. Clasp the skin there and then just sort of roll with your fingers and pick up your skin. As you roll the skin up towards the center of your rib cage like this. I'll show it again. You clasp it like this, you're unsticking the fascia tissue, and you sort of just slowly roll it towards the center and release. Real simple. I just do that once. In my opinion, I don't know if this really helped me all that much, but that is what I learned. So that is what I continue to do. But it might be something to look into. So the next exercise that's part of my morning routine is again on the ground, and it is called the ILU massage exercise. And this one is just sheerly for constipation. So your colon is in the shape of a U. The U, from your perspective, and so from my perspective really, there's a U shape right here. But within that U shape, there is an I shape on the left side and an L shape going from the bottom of the abdomen at the hip across the torso like that, along the colon. So there's an I, there's an L, and there is a U, like this. So what I was taught is to massage each element of that ILU acronym 3 times each, and that is supposed to help sort of move motility along. It's supposed to sort of counteract constipation just by waking up the muscles there. So take 2 fingers like this, each hand, press down at the bottom of your left rib cage. This is the bottom of the I from your perspective, if you're me, and sort of give it a few circular rubs, just gentle massages, and just sort of work your way down to the corner of the hip bone where your colon ends. Rinse and repeat, and do that 3 times on the I shape. After you've done it 3 times on the I shape, go over and do it 3 times on the L shape. So you start over here, the bottom of your right rib cage, and work your way across, massage your way across, just real gentle, and then down the I shape, and then back over to the start of the L shape over here, and repeat that 3 times. And then you do the U shape. So you start right by your bottom right of your abdomen, your right hip bone, give yourself the massage, the first part of the U shape, and then across, and then down. And you just do that 3 times. So it's 3 times 3, 9 total cycles for the ILU massage. So that's my morning routine. So next I will talk about the exercises that I do before and after breakfast, lunch, and dinner. So the most important exercise I do, and this is the one that is actually backed by a groundbreaking clinical study out of Barcelona, Spain, Dr. Fernando Azpiroz, the pendulum breathing technique is what it's called. My physical therapist said I could do it 3 minutes before and after breakfast, lunch, and dinner, but the study, they did it for 5 minutes before and after breakfast, lunch, and dinner, so that's just what I do. So the pendulum breathing technique can be done from standing, from seated, or laying down. And I will show you, why don't I show you the laying down first. So I'm actually going to go back on the ground. Now I'm on the ground. So the key with the pendulum breathing is you want to first inhale into your chest, and then what you will do is you will hold your breath and you will shift the air from your chest into your abdomen, still holding your breath. Then back up into your chest, then back down into your abdomen, and then release the air. So breathe in, it's in your chest, move the air from your chest to your abdomen, move it back up to your chest, move it back to your abdomen, and release. So it will look like this. And it can actually look quite dramatic. It can look actually quite forceful. And this is the way I was taught this exercise by a patient who saw Dr. Azpiroz. This was even before I went to physical therapy. So it looks like this. Again. That's how it looks. 5 minutes before and after breakfast, lunch, and dinner. Next, to continue talking about the pendulum breathing exercise, you can do this while seated as well. So I'm seated, and a slight wrinkle to throw into the whole pendulum breathing technique. It's unclear in the study from Azpiroz whether it was done exactly as I just did it right there, where you hold your breath the whole time, or whether you're breathing dynamically through the exercises. Different studies describe this technique differently. So it's unclear to me what the official right way is. So I personally just implemented both approaches. So to demo the more dynamic breathing approach, I'll do that right now. So when you bring your chest up, you want to bring your abdomen in. And when you bring your chest down, you want to bring your abdomen out. And on the chest up, you want to inhale, and on the chest down, you want to exhale. So it will look like this, actually. So if I, let's say, put my hand on my abdomen here, my hand on my chest here, inhale, chest in, up, and abdomen in, and then exhale, chest down, abdomen out. Now that I'm doing this exercise dynamically, without holding my breath, I'm more inclined personally just to be a little more gentle and not so forceful with forcing the air up and down, but just sort of letting it sort of rise naturally, letting it fall naturally. So again, it looks like this. And so that's how that would look seated. Now to show you how the exercise looks standing, again, hand here, chest up, abdomen in, chest down, abdomen out. It would look like this. Nice full breaths. This pendulum breathing technique, if I had to pick one exercise of the entire lot, is probably the number one exercise that I would do for fixing this whole APD problem, as it seems true in my experience that it's been the most helpful, and it seems true just also in the clinical studies that this is the one that really has some actual science behind it. The next exercise that I do before and after every meal are 10 breaths of what's called ribcage breathing. So ribcage breathing, you breathe in and out of your ribs. So if you put your hands on your ribs and you think about inhaling and exhaling into your ribs, you actually will feel your rib cage expanding and contracting. This is not necessarily the same as diaphragmatic breathing. My understanding of diaphragmatic breathing is you have your belly out and your belly in. This is you're breathing in and out of your rib cage. So you're keeping your focus and energy here as you breathe. So there's a couple layers to this exercise. So the first thing to think about is to take long inhales and exhales in and out of your rib cage. The second layer to add on to this is you want to think about, on the exhale, you want to think about pulling your abdomen inward. Literally, an arrow is parallel with the floor and pointing inward towards your abdomen. You want to pull inward as you exhale. So that would look like this. And as you hit the end of this exhale, you actually want to lock in place the position of your abdomen. You don't want to let your abdomen pop back out again. So lock it in place and continue the breathing. And try to pull in even deeper each subsequent breath, each subsequent exhale. And do that 10 times. Now, the final layer to add on to this that I really like is you can actually hum towards the end of your exhale. And once you're unable to hum at the end of your exhale, you actually know that that is the moment where you're no longer able to exhale. Because if you can't exhale, you can't hum. Not only that, but humming stimulates the vagus nerve, which is connected to all this neurological stuff and soothes everything. And not only that, but by humming to the point where you are squeezing out the last bit of your exhale, you are actually activating your transverse abdominal muscle, which, if you have APD, is deactivated, which is part of the problem with APD. So that would look like this. And then repeat that 10 times. So that's the ribcage breathing. The next exercise that I do before and after breakfast, lunch, and dinner is supine marches. This activates the transverse abdominal muscle. It's a little hard to explain, but I'll try my best. So you get on your back. Okay? And the exercise, I'll show it to you first. It looks like this. So these are marches that I'm doing, but more importantly what I'm doing is on the exhale, and as I lift my leg, I'm thinking about engaging the transverse abdominal muscle. This is not the same as a tense feeling that you would experience when you do like a crunch or like a lower leg kind of like lower abdomen kind of exercise. There's no bracing here. There's no sort of like burn here. that you get with normal ab exercises or even like planks. This is a much more subtle experience. So when I inhale and exhale and bring the leg up, I want to think about letting my belly sink downwards into the floor. And there will be a real kind of very subtle sort of sinking feeling you'll experience in your abdomen. And this activates your transverse abdominal muscle. That's what it is. So if you look down at your abdomen, you'll actually see that little divot right below your rib cage. It'll sort of dip in very slightly. So again, it would look like this. So you do 10 reps of those on each side. Now there are ways you can level up this exercise actually, make it more difficult as you progress through treatment that my physical therapist taught me. So the next way to kind of level up this exercise is to bring both legs up sequentially and then put them down sequentially. So it would look like this. Inhale, exhale. The transverse abdominal sinks downward, both legs come up, then left goes down, right goes down. And then inhale, exhale. So that's like level 2. Level 3 would be both legs at once, so it would look like this. As you do this, you're not bracing your core. You're just letting your abdomen sink downward into the floor. That's how I can best think of it. So those are the supine marching exercises. I would say that the supine marching exercises, along with the pendulum breathing, I would say the supine marching exercises are very helpful for me. Sometimes I'll forget to do them, and after a few days of not doing them, I'll notice a difference. The reason they're important is they activate the transverse abdominal muscle, which counteracts the diaphragmatic descent that you experience with APD. You're strengthening that abdominal wall and you're reinforcing the right kind of coordination between your diaphragm and abdominal muscles. So those are the exercises I do before and after breakfast, lunch, and dinner. Now I want to go into the exercises I do in the evening before bed. So the first exercise I do in the evening before bed is on the floor. And what it is open book stretches. That's the name. So what you do is you lay on your side with your arms in front of you, one shoulder above the other, your hands kind of together like this, with your one knee over the other, not totally at like, a 90-degree angle here, but kind of more like, I guess that would be like a 70-degree angle. And you want to inhale and exhale, and as you exhale, you want to bring your arm over to the other side like this. And if you're flexible, you'll be able to hit the floor. And if you're not, like me right now, you won't be able to. And then you bring it back to here. And then you repeat. And as you kind of bring your arm over, you really don't want to move your hips. You don't want to move your legs. You just want to move your torso and your arm. So you might think of somebody sitting down on your knees. You want your knees and your hips and everything to be totally locked down here. You don't want to open up like this, for example. So I'm not very good at this, but this is the exercise that I learned. And you can repeat it on the other side as well. or rather you should repeat it on the other side. Maybe I'm a little more flexible on that side. All right, so that's the open book stretching exercise. That exercise, it's supposed to help fix basically that rounded shoulders, kind of computer guy posture that everybody gets when they work in an office, which can actually contribute to just sort of like misalignment with this whole kind of like abdomen, diaphragm, spine connection. So I don't know too much about why this exercise matters in terms of the mechanics. I can't explain that to you, but this is what I was taught in physical therapy. So the next exercise is again for your spine. And what you need for this exercise is a foam roller. And this is called a Thoracic Foam Roll Extension. So you want to take your foam roll, and this is actually a small foam roll that I have at my parents' house. At home I have one that's about twice as big. You probably do want one that's bigger than this one, but this is just to demo it. You put your mid back over the foam roll, and you just lean back gently over the foam roll and then back up. Lean back gently and then back up. And that's supposed to open up your spine, basically, your vertical spine mobility. That's the best I can describe it. Breathing. So that's my full evening routine. So we've talked about the exercises I do in the morning, the exercises I do before and after breakfast, lunch, and dinner, and now and then we talked about the exercises I do in the evening, and now I'm just going to kind of go over some other tips and tricks that I was taught in physical therapy. So one tip I learned was, hey, I'm out in public and I'm experiencing symptoms. It's outside of the context of my normal, before after meals. It's just randomly. I'm just, I have symptoms. What do I do? So the first thing you can always do is you can always do the diaphragmatic release. You can do it standing, as we talked about, or sitting, or laying down. But if you're in public, maybe you're in your car, you can do it just sitting down, the diaphragmatic release, as we talked about. The next trick that my physical therapist taught me was humming. Not necessarily as we did with the full ribcage breathing exercise, the humming that we did, but you can just think about inhaling and exhaling to completion with a hum, and that will help soothe your vagus nerve. And she recommended that I do this humming technique 5 times total. So I'm walking around, I'm starting to feel like sort of symptomatic. I can just inhale, exhale, and hum. Till the humming is finished. And then the exhale is finished as well, because you can't hum if you can't exhale, and then repeat that 5 times. The next thing that my physical therapist taught me, if I'm out in public and I'm symptomatic, I can actually do seated versions of the marching exercise. So I can be seated, and I can simply think about pulling my legs up, again, not in this dramatic sort of lower abdominal kind of fashion, exercise fashion, but more just a subtle march that's slow and controlled while thinking about pulling my abdomen inward. A lot of these exercises have to do with pulling your abdomen inward. So like this. A couple final tips from my physical therapist, and this is actually comes off of her blog, which I can link to as well. When you're eating, think about eating slowly and upright. With an upright posture, your esophagus is totally aligned with your stomach and everything's totally aligned. You don't have a lot of constriction or tightness. I've found this to actually be kind of helpful. So nowadays, when I drink water or eat food, such as drink water, before I drink the water, I don't just chug it down. I think actually about that sort of physical sensation of pulling my abdomen in and upward, sort of fixing my diaphragm in place so it doesn't, my stomach doesn't bulge out. So, without doing the exercise, I might just chug it. And even now I see that my abdomen, it kind of popped out a little bit. But if I sort of correct it, kind of try to control my diaphragm and kind of pull it back up and in, I think even now you can see that there was a slight difference. I'll just kind of lock it in place and just think about pulling inward and upward. I just don't let it drop, basically. So I find that is really helpful. You might experiment with that technique of eating while upright. Other people with APD have said that they actually find it more beneficial if they sort of hunch everything forward while eating. So they'll do the diaphragm release and hunch everything forward and then finish their meal and then resume neutral posture. And they find that more helpful. So you might experiment what works for you there. The second thing that my physical therapist taught me, well, as far as like general lifestyle stuff that might help, is just managing stress. I don't really have a lot of tips for that. It probably works for you. Another thing is sleeping, quality sleep, 7 to 9 hours a night. Again, whatever works for you. And then the next thing is just getting exercise. And if you have APD, it's really tempting to just be on the couch all the time because it's so uncomfortable being out and about. But exercise is so good for you. You feel disabled. It is debilitating, but in a paradoxical way, you still can do things. So, try to make yourself go for that walk daily. Try to make yourself at least get some kind of exercise. So that's the whole sequence of everything I have to share regarding my physical therapy treatment. Thank you.